Have you ever had to beg your mom to take a shower, only for her to get angry? Maybe even start yelling. Maybe she tells you she already showered. Maybe she slams the bathroom door. Or maybe she looks terrified, and you're standing there thinking, what happened? My mom has always been clean. As a nurse practitioner, one of the hardest things that families have to deal with has nothing to do with medication. It isn't memory loss, it's bathing. I've seen daughters cry because they haven't been able to get mom in the shower for 3 weeks. I've seen husbands sleep on the couch because every conversation about bathing turns into an argument. If that's your family, I want you to know something. Your loved one is probably not trying to be difficult. Their brain may be telling them something completely different than what you're seeing. Today, we're going to talk about why people with dementia often refuse to bathe, what not to do, and strategies that actually preserve dignity while getting everyone through this safely. The biggest mistake families make is assuming, oh, mom just doesn't want to take a shower. Sometimes that's true, but much more often, there's a reason. Imagine walking into a room where you don't recognize anything. Someone tells you to take your clothes off. The floor looks slippery. The water sounds loud. You don't know who's helping you, not quite sure where you are. Would you feel safe? Probably not. You see, people with dementia can experience fear, confusion, embarrassment, feeling cold, difficulty understanding the steps, problems recognizing their own reflection, truly believing that they've already bathed, sensory overload from running water. To them, the shower may not feel like self-care. It may feel like a threat, so they refuse. They're often trying to protect themselves from something that their brain is telling them is dangerous. That changes the way we respond, or it should. Let's start with the things that usually make the situation worse. Number 1, don't argue. If mom says, I already showered, please don't spend 20 minutes proving she didn't. You're trying to use logic, but with dementia, it damages the part of the brain that processes new information. You will almost never win that argument. Number 2, don't surprise them, walking in saying, come on, let's go shower, because that can create a panic. Transitions are difficult. Preparation matters. Number 3, don't rush. When we're busy, we unintentionally communicate stress, and people with dementia often mirror the emotions of those caring for them. If you are frantic, they become very anxious. Number 4, don't make it about control. Avoid saying, you have to. Instead, invite, try guiding, encourage whenever possible, give choices. Even small choices help people feel respected. Now let's talk about strategies that work better most of the time. First, create a routine. The brain loves familiar things. Instead of random shower days, try bathing at the same time, on the same day, every week. Consistency reduces anxiety. Second, warm everything first. Think about it. Most of us hate getting out of the shower cold. Now imagine having dementia. Warm the room, warm the towels. Try and have everything ready before you ask them to come in. Third, offer choices, not commands. Try, or instead of, it's time for your shower. Would you like to try your shower before breakfast or after breakfast? Or would you like the blue towel or the white towel? The shower is still happening, but they get to maintain some independence. Fourth, simplify the environment. Too many bottles, too many towels, too many instructions, it just becomes overwhelming. Lay out one towel, one washcloth, one soap, one step at a time. Fifth, consider alternatives. Not every person needs a full shower every day. Sometimes a warm washcloth, a no-rinse cleanser, a partial bath, or even washing one body part at a time can preserve hygiene without creating a huge battle. Talk with your loved one's healthcare team to make sure you know what's appropriate. Sixth, use calm reassurance. Instead of trying to correct them, meet them where they're at. I'll stay with you. I'll go slowly. You're safe. I'm here. Those words matter. Seventh, know when to step back. If your loved one is escalating, yelling, swinging, or becoming extremely agitated, sometimes the safest decision is just to stop. Wait 30 minutes and then try again, because forcing someone into the shower can cause trauma and make the next shower even that much more harder. Sometimes bathing refusals isn't just an inconvenience. It can become a medical concern. Make sure to notify your loved one's healthcare provider if you notice persistent skin breakdown, pressure injuries, severe body odor despite cleaning attempts, urine or stool remaining on the skin, recurrent skin infections, unexplained rashes, increased agitation that seems much worse than normal. Because sometimes a sudden refusal to bathe could be an indicator of pain, a urinary tract infection, depression, or progression of dementia. It's worth bringing up at the next appointment or sooner if the change is sudden or severe. Caregiving asks you to do things you never could have imagined. Helping the woman who once bathed you, now refusing to let you help her. It's heartbreaking. If today didn't go well, it doesn't mean you're failing. It doesn't mean that she doesn't love you. It may simply mean that her brain is changing, and your job is not to win the argument. It's to preserve her dignity. But at the same time, keeping her as healthy and comfortable as possible. If this video helped you understand your loved one a little bit better, please make sure you subscribe to the Neighborhood NP. Every week, I share practical, evidence-based guidance on caregiving, chronic illness, kidney disease, mental health, and life behind the stethoscope. And I'd love to hear from you in the comments. What has been the hardest part of helping your loved one with dementia? Your experience may help another caregiver not feel so alone. I'm Erica, the Neighborhood NP. Thanks for hanging out with me, and until next time.